Alright guys, Dr. Kobe here at White Mountain Chiropractic and Rehabilitation in Wrench, New Hampshire. Here with Alyssa today to talk real quickly about what a patient can expect if they come to the office with sciatic type pain. So Alyssa is a patient and a co-worker of ours, so we've done a thorough examination, neuromusculoskeletal, family history, all that jazz. Everything's fine with her, so she's a perfect example, a perfect candidate for a demonstration today. When somebody comes in with sciatica and we haven't done those things, we're looking for a few key issues here. The wires or the nerves that come out of the low back supply the lower legs. So we're looking for any numbness, tingling, or burning, aching pain that's shooting down the leg. For the sake of argument today, Alyssa's dealing with that on the right side here. So, and the second thing we're looking for out of three, so first sensation, second is strength. So we go through and test each muscle group in her lower extremities, and in Alyssa's case, they all worked out fine. And then lastly, the reflexes. So we tap the knees and we tap the ankles, and we're looking for a reflex. Everybody's seen those before. Alyssa checks out great. If you are experiencing these types of symptoms at home and you're noticing that you have weakness, that's something that you're going to want to let your primary care or your chiropractor or somebody know right away. That lets us know that the impingement of the nerve is so significant that you're losing electricity from the brain to the muscles, and that can over time become permanent. So unlikely, but something to be aware of. Anyhow, so we'll get right to it with Alyssa and show you what a treatment looks like. If Alyssa wants to lay down on her belly here. This table here is kind of fancy. It's what's known as a Flexion Distraction table. It helps open up the joints where the wires come out of the low back. So if you see this here, these nerves can get pinched as they come out of the low back. This is an example of a disc. We may have some arthritis or bone spurs here that are impinging the nerve, or the nerve may be getting trapped in the soft tissue like the glute muscles as it travels down the back of the leg all the way down to the toes. So by putting a patient on this table, we can take gravity out of the situation and allow the table to move up and down like this, separating these joints from each other, pumping the discs, all while giving the nerve here more space to travel. Okay, so we're going to turn our table on here. We'll let Alyssa know that if at any point she's uncomfortable or her symptoms are getting worse, that she's going to let us know, because we need to change what we're doing. As she's moving up and down, those joints are opening and the muscles are stretching. I can assist that by getting my hand here and blocking specific levels in the low back, like so. And this is something that we might do for 5 to 10 minutes, finding sort of the sweet spots and tender areas in the low back and loosening them up as much as possible. After that, we move forward to a good soft tissue stretch. So we'd have Alyssa turn around and lay on her back. So she has pain coming down her right leg. We'll pay extra close attention to that one, but I'm going to use the left leg as a demonstration just because it's easier to see on camera. We're trying to give enough flexibility here to the pelvis so the pelvis can sit in an ideal position for the joints and discs in the low back. Ultimately trying to relieve that pressure off the nerve. We bend here at the knee, turn in, glute muscle stretch. Okay, so we've got a symptomatic leg on the right side. We might do a if we determine it's necessary, a hip manipulation. So this is where we start to get a little fancy. If I lean back like this, Alyssa, you're okay? Yep. Okay, and a little tug here. All right, doesn't look like much, but you can kind of feel a release in there, which loosens up the glute muscles. Then we'll have Alyssa turn on her side facing this way. And our goal ultimately is trying to restore range of motion to all the joints in the low back and release any muscle tension. Anytime we have an injury or pain, the muscles will typically increase our resting muscle tone. So that's why we make sure we get all that soft tissue work done as well as the manipulation of the joint. So we're going to turn towards me, and she's going to let me know if we're doing okay, still no extra pain, all right? And we'll give a little thrust right here, a little push, good, simple as that. She can tell you that she feels a little bit of a release in there, sort of like when you pop a knuckle. And then we'll have you turn on this side. Same thing. Good. There we go. And then we'll help Alyssa up. So that's about it for sciatic nerve pain. Soft tissue, joint manipulation. And then we finish up with some take-home exercises and rehab exercises. So it wasn't so bad, was it?
No.
All right.
Great.
That's it, guys. We'll see you next time.